Hi everyone, Dave Hogshead. I just wanted to give a quick overview of my new seminar, Weight Management and Joint Health Essentials. These are such great topics to combine together because if you can't lose weight, you're probably not going to have the healthiest joints and be able to get out of pain like you want to. And if you have a lot of joint inflammation and a lot of pain, you're going to have a much harder time reaching your weight management goals. So great topics to tackle at the same time, and these are both such great specialty niches to develop in your practice. And we're going to start the day with what everyone cares about the most. Burning this stuff, stubborn belly fat. We're going to talk about the advantages and disadvantages to working with weight management in your practice. There are things that are really fun about this specialty and things that can be very challenging. One of the challenging aspects for weight management is it seems like there are so many diets out there. So we're going to look at what all of these and other successful diets have in common. And you may have guessed one of the things all those successful diet books have in common is they get rid of this stuff, refined carbohydrates. Now, it's not shocking information for most people now to hear that carbs and sugar are a big factor in weight management issues. But even though people know this is a problem, a lot of people have very, very stubborn sugar and carb cravings. So we're going to talk about really effective strategies for slashing those stubborn cravings. If you can't cut the cravings, you can't quit the carbs. And if you can't quit the carbs and sugar, you won't burn fat no matter what else you do. So we're going to look at the top 5 strategies for greatly reducing sugar and refined carbohydrate cravings. Some of these are very simple, but very powerful results. And we're going to talk about how to objectively tell if you're burning fat for fuel instead of sugar. Most of you are familiar with the urine ketone strips for doing this, but there's some exciting breath analyzers now to tell if you're in nutritional ketosis. And we're going to talk about all the other health benefits of being in nutritional ketosis, even if you're not trying to lose weight, enhance brain function, mitochondrial health, and even as it ties into joint health for helping the body regulate inflammation. So these can be really, really helpful tools no matter what your health goals are. We're also going to dispel the myth that there's nothing fun to eat on a low-carb or ketogenic diet. Really healthy, really easy sugar-free desserts, pizzas, cookies, pretty much anything you want can be done now in a healthy way. So we're going to talk about how to encourage your patients with that and really easy online resources to use. And of course, we have to talk about the frustration of doing all the right things with your diet, cutting the carbohydrates, the refined sugars, but not losing weight with doing the right things. It happens a lot because of these and other health roadblocks: liver problems, sluggish thyroid, adrenal cortisol problems, hypothalamus gland dysfunction. Any one of these problems or a combination of these problems can slow down or completely sabotage your success, even with the perfect diet. So this is where we need to know how to use targeted nutritional and herbal supplements to make these organs healthy enough to burn fat optimally. This is where you can provide such unique help for your patients because so few of the weight management programs out there are effectively addressing these metabolic roadblocks, and it's really frustrating people. So we're going to talk about everything you need to know for your own personal weight management goals and how to help your patients reach their weight management goals. The second half of this seminar is going to greatly simplify nutritional and herbal support for musculoskeletal health. This is an area where most of you have your expertise in, but when it comes to using standard process and MediHerb products to support bone and joint health, promote a healthy inflammatory response, encourage connective tissue healing and repair, it can seem pretty overwhelming because it looks like there are so many supplements to choose from. And this is just one example when we look at some of the standard process products that support bone and joint health. It looks like a lot of supplements to choose from, but the common fundamental ingredient in all these formulas is bone. Some of these products have a lot of bone meal, some of them have a lot of bone protomorphogen, PMG extract, and some of them contain both bone meal and bone protomorphogen. But the most important thing to know is they all contain bone. And we're going to talk about why bone is such an important food for general musculoskeletal support. When you know the foundational ingredients of these musculoskeletal formulas, it makes them much easier to learn. We're also going to see why this one simple herbal blend of boswellia, turmeric, ginger, and celery seed is one of the most powerful things you can do to promote a healthy inflammatory response. This is what's in the Boswellia complex formula, and most people are familiar with the herbs Boswellia, turmeric, and ginger. But the quantity and quality of the extracts of these herbs are what's so important to get successful results. And we're going to see a recent study that found that about half of the Boswellia supplements on the market don't quite tell the truth from what's listed on their label and what's actually found in the bottle. So again, most people know about these herbs and know about Boswellia complex, but there's also some big under-the-radar nutritional therapies that combine so well with Boswellia complex that I think are really going to surprise you and help you get even better results with this formula. And when we're talking about bone and joint health and tools to help the body promote a healthy inflammatory response, we have to talk about pulsed electromagnetic field therapy, or PEMF. I believe this is the most synergistic therapy to use with nutritional and herbal therapies for many reasons, but one of the benefits of high-intensity pulsed electromagnetic fields is it's been shown repeatedly in studies to improve cell membrane permeability. And anything that improves the health of the cell membrane is going to increase the effectiveness of your nutritional therapies. I've been using high-intensity PEMF in my practice for a few years now, and I've never seen anything work faster for pain relief. And when you combine good nutritional and herbal therapies with this treatment modality, the sky's the limit for what you want to accomplish. So lots of fun and valuable information at this seminar, especially for your own personal health. Everyone needs some weight management help, and everyone can improve their musculoskeletal health issues. So I can't wait to see you there.